Let me see, can you watch my screen? Hello? Tell me something, I cannot hear anybody. Okay, great. So let's start. I think it's enough time to your classmates to get into. Well, I'm taking extra time for doing this. Well, today we have our fourth lesson. Yeah, today we are going to check the endocrine system, a general view about gynecology, pregnancy and birth, and childhood. About childhood is a very, very general view. The most common vocabulary and most common things that we are supposed to check now. Okay, so let's start. Well, as you know, we have the red guide. This is about our self-study, this anatomical review, a very fast one. Now we have this detail, a list showing the numbers and how to write down every gland. And the picture, just for making a general review where these structures are placed. So check this. Again, now we have specific hormones that are coming from the hypothalamus. So check this again, it's for you. And now extra details, right? General ones in order to consider this. Then we have this, the structures, combining forms, and functions. Of course, we are going to consider just major structures and combining forms. Adrenal glands, about the related combining form, are adrenal, gonads, gonadal. In male, testicles, testic or testicle. In female, ovaries or ovary, ovario. Pancreatic islets, pancreato. Parathyroid glands, parathyroidal. Pineal gland, pineal, pinealo. Pituitary gland, pituito, pituitario. The thymus, thym or thymo. Thyroid gland, thyroid. About the word part, we have acro or acro, following the extremities. I mean, could be top or at an extreme point. When we talk about extremities, we said hands and feet, okay? About adrenal, the adrenal glands, of course, crine or crino, to secrete. Hypendipsia, I mean, this is the suffix, the thirst. Glyc or glyco, glucose, of course, gonad or gonadal, we all know. Hypenism, condition, state of, okay. Pancreato, parathyroid, pineal, pituitario, poly, and hypen prefix is many, somato, thymo, thyroid. Okay, so we will know just for reminding this part. Now we have to check this slide in order to consider these two definitions, we can say, the excess and deficiency. When we talk about excess, we of course refer about too much, okay? So we can say, where there is an excess of hormone, one way of treatment consists on giving medication that inhibits the production of that hormone. For example, where hyperthyroidism is treated with carbimazole. So the excess of hormones, T3, T4, is controlled by the carbimazole, of course. The excess is going to be controlled by inhibition. About deficiency, when we say it's too little, I mean, when a hormone is deficient, the treatment may be by replacement therapy. For example, type 1 diabetes is treated with injections of insulin, with shots of insulin, right? So taking this idea about excess and deficiency, we can easily understand how hormones work by a pool, by a level that they really need to know or to have every time to help the body to work properly. This slide is for catching the vocabulary that is in black and words, because there are specific expressions and words for talking about the systems. We all know from the medical school at this point that we have the negative feedback systems. I mean, we get into the equilibrium, into the excess and deficiency level, we can say. If its negative feedback system is broken, we get in pathological situations that can support excess or deficiency. So, for example, in this chart, we can read this. The TRH, thyrotropin-releasing hormone, is secreted in the hypothalamus and triggers the production of TSH, thyroid-stimulating hormone, in the pituitary. Then the TSH stimulates the TSH receptor in the thyroid to increase synthesis of both T4, thyroxine, and T3, triiodothyronine, and also to release the stored hormone, producing increased plasma levels of T4 and T3. T3 feeds back on the pituitary and perhaps the hypothalamus to inhibit TRH and TSH secretion. So we know when a hormone is triggered, the other side, we can say, is controlled, it is under control in order to get the correct levels of the hormones. Just focus on the black and words to memorize these specific expressions, okay? And of course, the chart is for helping. Now let's talk about a very common situation in Latin America, I think in general, when we got the goiter or goitre. Both ways are correct. Goiter or goitre. Goiter for UK English and goitre for American English, okay? Of course, is the enlargement of the thyroid gland. I mean, this is a very, very huge enlargement. It's so big, very pathological situation, right? But of course, in our countries, we have the chance to check this, and maybe not a small amount, but it's possible to check. Not so frequently because we have supplements in the salt and it's easily to control, right? But let's read. May be diffuse, involving the most of the gland, or localized, limited to a particular area, as is a solitary or single nodule. The increased blood flow in diffuse enlargement may give rise to a palpable thrill, vibration felt with the hand, and an audible bruit, nose heard through a stethoscope over the gland. I mean, during the career, maybe you had a chance to check a patient like this and to feel the thrill of this, to feel the vibration when you place hands when they're the great bassa is very easy, very, very easy. I had a chance when I was at med school and that was amazing. And the bruit, of course, while placing the stethoscope, you can hear the pulse like the one pipe. It's so great. It's nice to hear, of course, going to the pulse rhythm. Well, a letter of referral is just for showing you this vocabulary, but we are going to practice on this at the end of the module and in module 2. The letter of referral is a document, it's a file that you prepare for sending a patient to a specialist evaluation. We as a general practitioners have the chance to evaluate in primary level of attendance our patients, of course, in a consulting room, I don't know, the emergency room maybe, but if we consider this necessarily, we prepare a referral to send a patient to someone else who can give more answers, I think. In this case, a letter of referral is talking about Mrs. Davis. The doctor has referred her to an endocrinologist in order to consider a situation, okay? This is just an example how to start doing this, but of course we are going to work with all of the stuff. We're doing a basic one, a basic letter of referral. We can say, dear doctor, I would be grateful if you would see this 50-year-old woman who has lost 20 kilos in weight and in spite of eating more than usual. She describes herself as overactive. Of course, we have this word to make a resume. It's not a medical term, it's a very common term, but we have the chance to use this in order to abbreviate information, okay? She describes herself as overactive, and at first she thought the weight loss was due to this. But more recently, she has developed palpitations, diarrhea, and heat intolerance. As you can see, we are describing with medical terms, okay? She has noticed that her hands have a tendency to shake. Her symptoms suggested hypothyroidism, and this was confirmed by my examination, which revealed an enlarged thyroid, red sweaty palms, and a fine tremor on the hands. As you can see in the letter of referral, we are using medical terms. Easy to do, easy to check, right? Now, going to the point with the most common situations about pathologies, we consider this: the pituitary gland, antidiuretic hormone conditions, the thyroid gland, the parathyroid glands, and the pancreas. Of course, check all of this, consider all the information that we are taking in account, okay? Talking about the pituitary gland, for example, we check gigantism, hyperpituitarism, maybe pituitary adenoma, functioning or non-functioning, the galactorrhea, prolactinoma, of course, the short stature, acromegaly. About the antidiuretic hormone, the conditions, we have diabetes insipidus, syndrome of inappropriate antidiuretic hormone, the SIAD. About the pathology of pineal gland, the pinealoma. Then the thyroid gland, thyroid carcinoma. Insufficient thyroid secretion could be, for example, Hashimoto's disease, or hypothyroidism, or cretinism, or myxedema. About the parathyroid glands, hyperparathyroidism, hypercalcemia, hypoparathyroidism, hypocalcemia. About an excessive thyroid secretion, we have thyroid nodules, thyroid storm, hyperthyroidism, the Graves' disease. Then the pancreas, we get the insulinoma, pancreatitis, the abnormal blood sugar levels. We can say hyperglycemia, hyperinsulinism, hypoglycemia. Okay, so let's consider all of this. Then we got the thymus, the thymitis. Then we have diabetic mellitus in all of these situations. I mean, the metabolic syndrome, type 1 diabetes, type 2 diabetes, then the pre-diabetes. Other ways, latent autoimmune diabetes in adults, the LADA, gestational diabetes mellitus, and diabetic emergencies. Diabetic coma, insulin shock, diabetic complications could be diabetic retinopathy, heart disease, kidney disease, peripheral neuropathy. So as you can see, it's a lot of information, right? About adrenal glands, we got the Addison's disease, adrenalitis, aldosteronism, Conn's syndrome, pheochromocytoma, Cushing syndrome, or hypercortisolism, okay? About the gonads, we get hypergonadism, hypogonadism, gynecomastia. As you could see, a general view, just considering specific points to take in account, okay? Abbreviations is for you. Please consider all of them in order to check more details. And during the slides, if I show you a few, well, of course, they are going to be into the homework files, final test, everything for practicing. Talking about gynecology, we should consider this anatomical review at the beginning, the external anatomical review, okay? Female external genitalia. with all of the details, everything in English at this moment, okay? Then we have this cross-section, considering again the structures of the female reproductive system. For you, practice on this. And then we have this schematic view about the uterus, fallopian tubes, and ovaries, okay? So let's take this in count in order to practice and, well, being clearly about it. This slide is showing you the vocabulary we should get familiarized and consider that it's important to check without trouble, okay? We got the nipple and areola, lobules, ducts, connective and fatty tissue, muscle, of course, blood vessels, lymph nodes, sentinel lymph nodes. Going to the anatomical review, we got this chart, okay? Checking all of this, it's possible to understand this information, of course, and make the relationship, how they are placed and about its functions, okay? So let's consider this, practice on this, it's for you. And now I have this chart, structures, combining forms and functions. Well, just as an information, I wrote down, well, we get the male and the female structures, okay? About males, we got penis, then penny or phal or phalli. Testicles, orco, orchido, testi or test. About female, we got ovaries, and we can say ophoro, ovarium. The fallopian tubes, salpingo. Uterus, hystero, metro, metrio, utero. Vagina, vagina or colpo. And the placenta as a great organ, placent or placento, okay? Well, word parts, cervix, cervico, colp or colpo, hypengravida, that's a suffix, of course, gyneco, hystero, masto, meno, orchido, ovo, ovario, hypempara, hypempexy, salpingo, testi, and vagina or vagin, okay? Now let's check this slide, this huge information, because, well, we have lots of here. When we talk about menstruation, we have lots of terms that we must consider and take in account. The most important terms are in black and words, the words that we need to memorize in order to write down properly. So let's go with this. A period is the common name for a menstrual or monthly period. The onset of menstruation is known as menarche. The last menstrual period is commonly abbreviated in doctor's notes as LMP, last menstrual period, LMP. And it goes with this formula. 2 weeks, it means 2 weeks. 2 weeks in a year ago, 2 weeks ago it means the last menstrual period was 2 weeks ago. The menstrual cycle or length and frequency of periods is usually written in the form 4/28, which means lasting 4 days and occurring every 28 days. Okay, possible to catch this. It's the same as Spanish. If a period lasts more than 4 or 5 days, it can be described as prolonged. The term heavy periods means excessive blood loss, I mean menorrhagia, often with the passage of clots, coagulated blood. The term period pains means dysmenorrhea or painful menstruation, okay? So as you can see, we have specific terms here, specific ways to express this information. Going ahead, the time when a woman stops menstruating, normally at about the age of 50, is called menopause or climacteric. In everyday English, it's known as the change of life, or simply the change. Every woman has the chance to be into the change. Symptoms of menopause include hot flashes, sudden sensations of heat, and night sweats. This is just for practicing vocabulary, just for checking information. We have the phases of the menstrual cycle: the menstrual phase, post-menstrual phase, ovulatory phase, and premenstrual phase. Just for catching vocabulary in order to increase. I'm not going to take this slide in count for homework or files or anything. It's just for increasing vocabulary. Check this, it's for you, extra information. The menstrual cycle, well, here you got the explanation, now you have the picture. Is for making a remind. If I'm sending this red guy for showing that it's homework, it's just for remind that we must practice the vocabulary. Well, about the menstrual pain and its symptoms, we got abdominal pain, increases the chest, back pain, and headache. And of course, what we can do, the diet, the pills, massage, take warm, sleep, and walk. Well, all the home care we can do about this situation, okay? Now we got this gynecological consultation when we have the chance to check specific ways to ask for information. I need 2 volunteers, please. 2 people. Hi. Okay. Laura Yawita, are you there?
Yes, I'm here.
Laura, I'm sorry, can you hear me?
Yes, I can hear you.
Perfect. You are going to be the doctor. I'm going to be the patient, okay?
Okay.
Let's go ahead. Let's start.
Okay. Are your periods regular?
Yes.
How often do you get them?
Every 4 weeks.
How old were you when you started to get them?
About 12.
When was your last period?
A week ago.
How long do the periods last usually?
4 or 5 days.
Would you say they are light or heavy?
Light.
Do you get clots?
No.
Do you get period pains?
Not really.
Is there any discharge between the periods?
A little.
What color is it?
White. Okay, thank you, Laura. As you can see, this information is just going to the point and the patient is just giving the answer without rounding information or giving extra information. That's a very common situation that it happens in this way, even in Spanish, of course, because it's not a very comfortable situation to talk about this monthly situation, right? But the most important part of this is the vocabulary we are checking this and the way we can ask, how we can ask for this information, how we collect all the details we should consider. So practice on this, check the way to do the questions and it's gonna work. Talking about contraception, of course, is very important. We have these contraception methods, the most common ones, we all know about it. The condom, female condom, diaphragm, hormonal ring, UID, contraceptive injection or contraceptive shot, the implant, contraceptive patch, oral contraception, surgical sterilization. But just as an infogram, We can complete the information with all of this. How well does birth control work? How we know they are effective or not? We must add the spongy, the cervical cap, the spermicide, fertility awareness, and the withdrawal. Checking the percentages, just for getting a bigger idea and maybe showing the way to express this information, right? Now let's go to the pathologies of the gynecological system. We have the ovaries and fallopian tubes. Then we get the uterus, the cervix, and the vagina. About the ovaries, fallopian tubes, and ovulation, we got all of these lists. Anovulation, ophoritis, ovarian cancer, ovariorexisis, pelvic inflammatory disease, the PID, polycystic ovarian syndrome, PCOS, pyosalpinx, salpingitis, endometriosis, metrorrhea, endometrial cancer, uterine fibroid, the myoma, uterine prolapse, cervical cancer, cervical dysplasia, cervicitis, endocervicitis. Then we got the colporexis, dyspareunia, leukorrhea, vaginal candidiasis, vaginitis. Okay, in general view, I think there are some more, of course, but for taking in count, I think they are enough at this point. Going to the external genitalia, breast disease, and menstrual disorders. Of course, we have big lists. We got the pruritus vulva, vulvodynia, and vulvitis. Then we got the breast diseases with breast cancer, fibroadenoma, fibrocystic breast disease, galactorrhea, mastalgia, mastitis. About the menstrual disorders, we get amenorrhea, dysmenorrhea, dysfunctional uterine bleeding, the DUB, hypermenorrhea, hypomenorrhea, menometrorrhagia, oligomenorrhea, polymenorrhea, premature menopause, premenstrual syndrome, or premenstrual dysphoric disease, PMDD, right? So let's take in count, let's consider this abbreviations too for practicing, and then practicing pronunciation, how to write these pathologies down, and well. Then we get the abbreviations just for being in a general view. For during the presentation, you had the chance to check that we have some abbreviations in the paragraphs. Consider them too, okay? This slide is nice, I think, because it has history to show, to reveal. This body comes from a museum. This museum is called Bodies too. This exposition has a specific characteristic where you get the chance to see different anatomical structures that are coming from real patients. I mean, people who decide to give his body in order to study, to how anatomical landmarks are in real life. And well, this museum prepares travels around the world showing specific parts of different situations. In this case, we are checking a lady who is pregnant and has a baby for around 8 months. But this specific lady is coming from Korea. I mean, it's supposed to be a model, but no. This body is related to a murder. When this murder is considered at this point, nowadays as a mystery, because the lady who's here could be a Korean lady who disappeared a few years ago, and well, she was pregnant. This lady was divorced, but she got in a relationship with someone who was not divorced, someone who had lots of money, and suddenly this lady disappeared. So when her family was looking for her, one of her sons, a young boy, checked the museum and noticed that the face of this lady was very similar to his mother's. And well, actually, this body is not in the museum because it's under investigation, but it's a way to show that it's possible to study these anatomical landmarks, but we certainly don't know where they are coming from. So just for considering. We start with this because we talk about pregnancy and birth. And here we have the chance to check the relationship of the baby with the mother and how organs change in position, right? When we go to the anatomical landmarks, only checking the pregnancy, we consider the fetus, the uterus, the placenta, the amniotic sac, and how all the abdomen changes in shape. It's a normal pregnant uterus with one baby in a cross-section. And now we have fraternal twins, right? You can see position changes a lot. Here we have two placentas. It's nice. Now we have an anatomical cross-section showing how position of every organ in the body changes according to the pregnancy time. Well, and now let's check this, the childbirth, the delivery. When we check this, we must take in account that we have a specific words, specific expressions to talk about it, specific ideas to show to our people, we could say. And we can start this. The expected date of delivery, the EDD, is the date on which a woman is expected to give birth to the child that she's carrying. Is pregnant with. It is calculated by adding 2,080 days or 40 weeks to the first day of the last menstrual period, the LMP. Childbirth is also referred by doctors as parturition. They are synonyms. Childbirth and parturition are the same. Delivery is the process of helping the child to be born. Doctors are helping the baby during the delivery, right? A spontaneous vaginal delivery, SVD, is normal delivery like this. If there are complications, the baby may be delivered via cesarean section, a C-section, surgically removed. We all know about it, but the specific terms we are checking now and abbreviations are in black and white for taking them in account. A full-term pregnancy is 40 weeks divided into 3 trimesters. A baby who is born before this is premature. Less than 40. And one born after 40 weeks is post-mature. Okay. A baby who's born dead, for example, because of the umbilical cord is around his neck, is stillborn. The stillborns, of course, are not a pleasant situation. It's so hard to treat this situation and give the causes, but the term is stillborn. Okay, so don't get confused on this. A pregnancy may end before term spontaneously with a miscarriage. Spontaneous abortion. Or be deliberately terminated with an induced abortion, termination of pregnancy with pills, with chemical substances, well, we don't know. It's different, a miscarriage with an induced abortion. Take this in count, okay? Abortion is not the term for every end of the pregnancy, okay? Note, the verb induce means to cause something to happen, okay? About the labor, this process, well, by which the fetus and the placenta are pushed out of the uterus, okay? That's the labor, specifically. The baby and the placenta are going out, are pushed out. We say it's the labor, don't miss on this. We have 3 stages of the labor. The cervix relaxes, causing to delay and thin out. You can see. The stage 2, the uterine contractions, increasing the strength, and the infant is delivered. Is the process when the baby is pushed out, right? And the placenta is expelled as a stage 3. When it's expelled, finishes the delivery, okay? Well, another chart, another picture to check this with this cross section, checking again the stages. And now we got the presentation and lie. Very important how to express about it. Fetal lie is the position of the uterus, of the baby, of the fetus into the uterus. This is the fetal lie. Okay, the normal lie is longitudinal, and abnormal lie is transverse. Longitudinal, the fetal lie, and transverse. And the presentation refers to the part of the fetus which occupies the center of the pelvic canal, and which the examining fingers feels on vaginal examination, the butterwort, okay? The normal presentation is with the head. I mean vertex presentation. This is vertex presentation. But we can get the bridge presentation. The bridge presentation means the buttocks are presenting. Bridge is an old word of buttocks, okay? For talking about medical history, we decide to conserve this term, bridge presentation. Okay, abnormal presentations may require delivery with forceps. I mean, that piece that catches the baby part, I mean, could be the pelvis or the head and helps to push the baby out, okay? This presentation, frank, complete, incomplete, just extra information, don't worry about it. Just remember, the normal presentation, the vertex, and the bridge presentation when the baby sits. And we can feel the buttocks during the vaginal examination, the butterworts. Then we have some pathological, well, the normal presentation and some pathological presentations. For example, the face broad, the shoulder, the frank bridge, complete and incomplete, okay? Just for showing. Talking about childhood, we must consider that it's a very small period in life. And well, we can give a definition, is a period during which a person is a child from birth until puberty. So as you can see, it's very small period. And during this small period, we have the chance to live many things and to form the basis of our personality, right? But when we are babies, when we are still growing up faster in our lives, we must reach milestones. A milestone is a child's development by age. According to the age, we can evaluate the baby and check if they are achieving some movement, some attitude, some new characteristics, maybe we can say. And we are taking them in count month by month, 1 month, 2 months, and every month we have something new. Check this, it's for you. for catching specific vocabulary and practicing specific terms. During the workshop, we are going to work with the milestones. Then you have another chart that is different from the previous one, but it's giving you more information, details at this point. We are checking gross motor, fine motor, personal and social attitudes, and speech and language. Then we have these 5 key areas of development that we always have to practice. We always have to evaluate with our patients all the time. We consider the gross motor skills. For example, crawling, jumping, or running. According to the age, we evaluate if they are achieving these activities, right? Fine motor skills, such as writing and drawing, according to the age again, if they are making lines or circles, how they catch the pen. Well, we have to consider all of these details. The speech and language, again, according to the age, we can realize if the baby is learning how to talk or not, or if the baby is giving us a specific information. I mean, if they use words that they really need to learn for talking properly, or they are pronouncing properly, or if they construct ideas in the way they have to do according to the age with 2 words, 3 words, 5 words, short phrases, if they are gaining enough vocabulary, okay? Cognitive and intellectual, such as counting or identifying shapes. We can evaluate this, for example, giving them toys for placing in its shape or for comparing colors. According to this, we can realize if they are going in the proper way, if the brain development is correct. And social and emotional skills, such as playing with other children, how they get in relation with their relatives, with kids as them. If they have the capability of socialize, of making friends, of course, it's very, very important to consider all of this. In this point, we must consider common infectious diseases. Okay, common infection situations that we as doctors got in a vocabulary, how common names are into society, we can say, with parents. For example, when we talk about rubella or morbilli, the common name is measles. Parents can come to you, to your medical appointment, to medical consultation, and then tell you, my baby has measles. Measles is referring to the spots that they have on the skin. And these measles are, well, are for receiving treatment, of course. Talking about specifically about the rubella, we got German measles. It's a different way. They are bigger than measles, common measles, okay? About, we as a doctor says varicella, but common name is chickenpox. Chickenpox, okay? Because of it, the shape it gets when it's on the skin. Then we got infectious parotiditis, and parent says mumps. We got pertussis, and parent says whooping cough. Let's consider this. Then we as doctors say acute laryngotracheitis, and they say croup. Even in Spanish, we say croup to this specific situation, right? And the croup is that kind of cough. We all know about it. The croup that is coming from the trachea and larynge, okay. Then we got the scarlatina. Parents say scarlet fever because of the color it has. Scarlet is a red color, commonly than white. Commonly than wine, similar to wine. Or rheumatic fever is the same. And then we have tetanus. It's the lockjaw. Why the lockjaw? Because how babies that get tetanus, well, nowadays it's not common to see this. When they get tetanus, how they pressure the jaw of in the mouth, and it's locked. It's not possible to open. That's why it's called lockjaw. Poliomyelitis, well, the common way, polio, right? Check this, it's important. I think it's nice at this point. And now we have a situation that nowadays is becoming common to our society. Could be because of the new kinds of diet, maybe the medication that we are now receiving previously than natural medicine, or maybe because genetical changes that we suffer through the time. Is the celiac disease. You can notice here this detail. In so many expressions, you're going to see an O between the E or the A. This O is referring to UK English, okay? British English. Or without the O, celiac disease, the US, American English. In both cases, pronunciation is the same. There is no trouble on this. It's just the vowel that is added for making a difference while writing down, but it's not a mistake. It's just a detail, okay? In this chart, we are talking about this specific situation. Well, it says, celiac disease is a disease of the small intestine caused by sensitivity to gluten. It can present at any age, but in infancy, it appears after weaning onto cereals containing gluten. The clinical features include diarrhea, malabsorption, and failure to thrive. There may be signs of malnutrition, and there may be some abdominal distension. There is the light growth and the light puberty, leading to short stature in adulthood. So we check in black words, specific expressions too. And now we have the meanings of this. For example, sensitivity to having a negative reaction to. I mean, by eating gluten, you have a bad reaction, a negative reaction to the gluten, and then you start with this situation. The weaning is changing the diet from milk only to solid foods. When it's not properly done, we can cause the celiac disease or different pathologies, right? Weaning is one of the most important activities that we must control while being doctors, or maybe when we become parents, because we have to know how to do this, how to make the change, how to evaluate, and how to identify when the food is being a problem. Then we have the clinical features, the symptoms and signs of disease, the malabsorption, poor absorption. The malnutrition could be poor diet because of the nutrition, or as an adjective, malnourished, okay? To thrive, grow strongly. I mean, failure to thrive, failure to grow strongly. The distension in this context comes as swelling, some abdominal distension, some abdominal inflammation. Delayed, later than expect. I mean, it's delayed because it's not at the moment it has to be. Delayed growth, the kid is not reaching the stature or the weight that has to reach according to the age. Failure, when something that is expected does not happen. I mean, failure to thrive, I mean, it's not catching or not growing strongly in the way it should be according to the age. Well, we say the stature, size, especially height, right? So considering all of this, practice this vocabulary, the black words, and then we can talk about them tomorrow during the workshop. And never forget it, just keep working. Keep working, keep practicing, because it's important for us to catch all of this vocabulary, okay? Let me send you the pool to take attendance. Only you are here. Okay. Please fill the pool. I'm going to upload the presentation as you are filling this, okay? Okay, let me see. I need one more. Everybody could check the pool. Let me see. All of you could watch the pool. Please let me know if it's not possible. I have to look for a solution about it, okay? Hello. Okay, Laura Peredo, Pablo and Sara could fill the pool, thank you. What about, okay, Dorian, thank you. Elena, could you fill the pool? Laura Yahuita, Andrea.
Yes, I could.
Perfect. Andrea, did you fill the pool? Laura Yahuita.
Yeah,
You did it. Okay, Laura Yahuita, are you there? Okay, let me see. I upload the presentation to the chat. Please download it. It's for you. Let me know by a message that you got it, okay? Perfect. Got it, Laura. Great. Okay, while getting the presentation, you can leave the session and let's meet tomorrow, okay?
see you. Bye.
See you. Bye-bye.
See you tomorrow. Bye.
See you. Bye-bye. Okay. Okay, bye. Bye-bye. Bye, Dorian. Thank you. Well, Pablo, if you can send me a message telling me that you got the presentation. Laura Yahuita, are you there? I'm gonna close this. It's for your attendance. Laura Yahuita. Laura Yahuita. I don't know if you are there or not. Pablo, thank you. See you tomorrow. Let me send her a message. I don't know where she is. Because I need to close this. Yes, Pablo, the first homework file is for tomorrow. Well, the two files actually, the writing exercise and the complete file about the first three presentations. Let me see, because Tuesday at midnight can be interpreted. No, Tuesday, well, tomorrow midnight. Tomorrow finishing the night. I'm gonna write it down to the group. Thank you for showing me this. Yes, tomorrow the homework. Don't worry about it. You have the whole Tuesday to fill it and then you send it to me. Well, yes, until tomorrow. Okay, bye. Bye, good night. See you tomorrow, Pablo. Okay. Let me close this because everything is done. We're going to finish this. Bye-bye. Let's close this, all of this. What is the pool?